Hello dear students, we will continue our discussion on the terminal topics of the medical microbiology, and we will talk about a disease whose name has been given at the name of one of the town in Massachusetts state of the Connecticut state of the United States, and the name of the town is the Lyme town, and the name of the disease that is being produced by the spiral-shaped microorganism is the Lyme disease. And as you know that the spiral-shaped microorganism, they are from three different important genera, starting from Treponeme, then we have the Leptospira, and we have the Borrelia. We are already through with the Leptospira, and we'll today start with the Borrelia organism. But before we move on to the Borrelia, the pathogenesis, its epidemiology and transmission, and the diagnostic procedures that we can follow to diagnose the disease, let's recap in a few minutes regarding the ultra-structure of the spirochetes. And we are now well versed that the spirochetes are the spiral-shaped microorganism, and their flagellum, which is known as the endoflagellum, because this is enclosed in the sheath. And the cell wall, if you look at this, I mean the transverse section of this organism, it has a cell membrane, it has the outer membrane, and in between this space, what we call as the periplasmic space, which is an integral part of the gram-negative microorganism. So this makes sense to designate this microorganism, the spirochetes, that the gram-negative, but because we cannot stain these microorganisms with the gram-stains procedure or with the acid-fast stain procedure, so we'll have to adopt some special procedures for the identification of this microorganism. The outer membrane of the spirochete cells is true with that of the other gram-negative microorganism. It is as you see, the many antigenic proteins, and that contributes towards the what you call as the serotyping of this microorganism. So the spirochetes, which are spiral-shaped microorganism, they have the endoflagellum compared to that of the flagella of the gram-negative microorganism. They do have the periplasmic space, and they do have a diversity in the outer membrane of the organism. Now we will move on to the clinically important genera, Borrelia. We have already through with this Leptospira, and Leptospira, as we all know, that we have the Leptospira interrogans was the name of the organism, and this organism, it was transmitted through the food or drink that has been contaminated with the urine of the animals like dog, cat, pigs, cows, and this organism, the Borrelia, the Leptospira, it was thin and tightly coiled microorganism. Now the Borrelia compared to that of the Leptospira, it is not that tightly coiled. If you look at the configuration of the coiling configuration of the Borrelia, they're large and they're loosely coiled compared with that of the Treponemes and that of the Leptospira. Now we have two important species of the Borrelia burgdorferi, and that causes the Lyme disease. Another species of this organism is the Borrelia recurrentis. This causes what we call as the relapsing fever. So two different diseases of Borrelia species caused by two different species. The Borrelia burgdorferi causes Lyme disease. Borrelia recurrentis causes relapsing fever, and the transmission of both of these organisms is with the help of ticks, particularly the tick bite of Ixodes genus. They are connected with the transmission of this disease. If you look at the lower side of the slide, that this is the tick which has been engorged or full with the organism, and it just bites at the skin and pushes its head inward to the skin and releases the organism into the body. The organism, as we have seen with case of the other spirochetes like Treponema, species Treponema pallidum, that causes syphilis, Borrelia, and Leptospira. We can stain the Leptospira because the Borrelia, because they are larger animals, the organism, and we can stain them with the GENERA stain or the other blood staining dyes that we can use for this purpose. The organism can also be seen with the help of 2-3 other mechanisms that we have already discussed. In case of Leptospira, we can see that organism under the dark field microscopy. We can go for the what we call as the silver staining or silver impregnation of the organism with the stain, and we can see with the help of immunofluorescence. So all these 3 procedures, they can be adopted for the visualization or microscopic visualization of all these 3 genera of Leptospira, of these spirochetes, the Leptospira, Borrelia, and Caponims. These organisms, they are not normally grown onto the laboratory culture media. But if we attempt that, they need some of the complex composition of the media, they need blood to grow, they need some tissue extract to grow. So we need specialized kind of media for the culture of these microorganisms. Now the Borrelia, they morphologically, or if you look into their structure, they are distinct from the other pathogenic species of the Borrelia. So we do have some of the cancers or non-pathogenic species of the Borrelia, but the Borrelia recurrentis and Borrelia burgdorferi, these are the 2 pathogenic species. Now the Borrelia disease is not that common in Pakistan. It is very common, very, very common in the United States on both ends. I mean, in the Pacific Ocean and the Atlantic area, the east and west coast of the United States. This disease is common because the causative or the transmission ticks which are responsible for the transmit of the Borrelia from the animals to the humans, they are found in the desert and in the area which are rich in deers. So the pathogenic species, they are different with that of the non-pathogenic species, and they're comparatively large. If you look at over here, they are the large, irregularly spaced. You have some of the have the more space in between the file. Others have the little space, and they do have the endoflagella. The human infection caused by the Borrelia is known as borreliosis. The Lyme disease can also be known as the Lyme borreliosis. So based on to the causative organism. The transmission is through the arthropod vector, which are mainly, you see the ticks, particularly the ticks of the Ixodes genus. That's what we call it, the Ixodes scapularis, and we have another species of that. The most important diseases caused by the Borrelia are the relapsing fever and the Lyme disease. So the relapsing fever is also known as recurrentis fever. So we will discuss in detail in the coming slides. So the 2 different organisms causing 2 different diseases belong to the same genera of Borrelia. The Lyme disease is caused by the Borrelia, the relapsing disease is caused by the Borrelia, but we are with the different species. Now we will take first the Borrelia burgdorferi that causes Lyme disease, and the disease is transmitted by the bite of tick of the genus Ixodes. Now, and the 2 species of these genus Ixodes disease ticks, the one is the Ixodes scapularis, and the other one is the Ixodes pacificus. Now, scapularis is prevalent in the what you call as the East Coast, near DC, in New York area, in Massachusetts, in Connecticut. Pacific area, that is more towards the, you see the LA or the California area, this is prevalent over there. The overall incidence of the disease in the United States is more than 200,000 people every year. But this is underestimated. This is the figure of the CDC Atlanta. But the clinician believes that they have more cases compared to that. About 50% of the cases, they are because of the scapularis, means that they are reported from the East Coast, whereas rest of the 30 to 25% of the cases, they are from the California area. Now, this is the what we call as the tick, known as scapularis. And if you look at this, it has, you see the wings, the black spot over here. And this tick, the lower side, it is engorged with the Borrelia burgdorferi. The tick, it sucks the blood from the deer. And then you see the Borrelia, it undergoes their development in the tick. And the tick is then engorged and is full of and ready to rupture and squeeze the organism or ingest the organism into the human body. So this is one of the most important, most prevalent vector-borne disease. Tick bite vector-borne disease in the United States is the Lyme disease. The greatest concentration is in the area where there is a high population of mouse and deer population. The disease is not fatal, but it often involves into slow progressive syndrome. And the symptoms caused by this disease, they have the similarity or mimicry with that of the neuromuscular or rheumatoid or conditions of the bodies. The most common tics and the vector-borne disease are studied in the United States. So there is involvement of the neuromuscular system and involvement of the skeletal musculoskeletal system. What happens actually, you see, the disease is spread by the bite, and once the tick, it bites the skin, then it protrudes inside into the skin and the lesions starting developing in the surrounding area, if you look over here. Now, after intense and putting the organism in the skin, they disseminate via the blood to the heart, to the joints, and to the central nervous system. So there is hematogenous spread of this disease, leads to the lesions in the heart, joint, and tissues of the CNS system. If you look at the virulence factors or the component which are involved in the production of the disease process, there is no endotoxin production, there is no exotoxin production. There's some enzymes or other virulence factors are involved, but there is no evidence of the production of any kind of toxins. The clinical findings, we can divide that into 3 discrete steps that we cannot really demarcate. We cannot really discriminate between the 3 different stages of the disease. There is the stage 1, stage 2, stage 3, and we'll see that how these stages go on. But if you look at this, this component of the slide, the Borrelia burgdorferi bacteria, there you see the deer ticks, they are infected by the bacteria, and then of course the female is responsible for the infections to the human, and this is by the bite of the face. So the genus Exodes, species Scapularis, they really bite the humans, ingest the organism inside, the organism goes into the blood, hematogenous spread takes place, and then the localized signs and symptoms due to the involvement of the various body organs you can see. Mostly the neuromuscular systems and the musculoskeletal system is involved in this case. Now in this stage 1, and we have the 3 stages of the development of this disease, and as I said, we can really not discriminate or demarcate between the different stages of the disease. But in the stage 1 is what happens, you will see the rash on the side of the tick bite. And this classical rash that you see the central bite, then, sorry, there is the central bite of the skin, and then there is the meatus area on the skin, then this area spread around. This is what we call as the erythema migraines or erythema chronicum migraines. This is how it looks like. Because the lesions, they look like the bullseyes, there is raised area, ring around the lesions, so this is what we call as the bullseye type lesions. So whenever there is a word like bull eyes, this really designates to the first phase of the Borrelia infection caused in the Lyme disease. Now, if not treated at this earlier stage, what would happen? The disease can enter into the second stage. So initial stage, there is erythema, and there is the bull eye-like appearance of the erythematous lesions or rings. And if we do not go for the treatment in this stage, what would happen? The ultimate outcome would be the entrance of this disease into the second stage. Now, what happens in the second stage? This is manifested by the involvement of the cardiac and neurological involvement. There is myocarditis. There can be acute aseptic meningitis. Now, remember, in Leptospira corydons, we have also seen the aseptic meningitis. So, in case of spirochetes and in case of viral infection, mostly the meningitis is aseptic meningitis, and this results into the change in the protein level in the CSF, and we diagnose the disease whether it's of spirochetes in nature, viral nature, or bacterial in nature because of the prevalence of the proteins. Now, there is cranial neuropathy, and particularly this organism in the second stage, it causes damage to the 7th cranial nerve. And that's what happened, what called as the Bell's palsy. You see the symptoms of the bilateral plasmapheresis is the characteristic outcome of this disease in the second stage. Now, in the third stage, there is arthritis with large joints. Now, there is arthritis, but there is no inflammation. There is no inflammation. So mostly, you see, we say it's not a real arthritis; it's arthralgia. So technically speaking, it's not arthritis; it's arthralgia. Swelling is not much, but the pain is very severe. So here you can see that how the facial expression would look like in case of Bell's palsy. And this is due to the damage of the seventh cranial nerve caused by some of the enzymes, or maybe some of the, not exotoxin, but the endotoxin liberated by the Borrelia burgdorferi. This again is the lesions of the Lyme disease on the human calf muscles. And if you, the lesions, they are flat, reddened rings in the form of bullseye. These are the primary lesions, and which gives a large number of secondary lesions into the other locations. So very characteristic are what you call as the pathognomonic lesions. Pathognomonic lesions are those which really give you a clear clue to the causative organism. So these ring-like lesions that appears like the shape of the bulls, what we call a bullseye, that is what we call the bullseye lesions, they are very characteristic, as we have seen in case of negri bodies in the brain caused by the rabies virus when we have gone through that. So these lesions are very much characteristic. Now the history of the patient traveling in the area where the exudates are very common, then you see the bite of the exudates goes unnoticed. And you cannot have any signs and symptoms maybe for a couple of weeks' time. But later on you will see some of these edematous lesions that would appear on the bite, at the bite site. The Lyme disease, you see, the diagnosis, it's very easy based on to the clinical signs and symptoms and the history of the traveling of the individual. The presence of the ring-shaped lesions, which are very common. Then the isolation of the spirochetes from the patient is hardly attempted. But if we have to go, we need some highly enriched media like that contains blood and that contains the tissue extract. The serological testing with the help of ELISA and other agglutination tests is very common. The positive test confirmation always done with the help of the Western blot analysis. Now, Western blot is the isolation of the proteins, and then we run this protein on the polyacrylamide gel. We provide some of the buffer zone and with that of electricity, and then the proteins they run. Then we transform these different bands of the proteins separated at various molecular level, weight level into these cytocellular membranes, and we see that with the help of staining procedure. Either you can go for the Ethereum bromide stain, or you can go for the silver stain. Or more specifically in the current era, you can go for the PCR. The probes are there, the DNA have been all fingerprinted, and we can really identify the microorganism based on to the PCR. Now we move on to the second disease caused by the Borrelia, what we call it, the Borrelia recurrentis or the Borrelia homicide. There are many other Borrelia that can cause these diseases, what we call as the relapsing fever. Now, as the name indicates, the fever occurs in relapses, or fever reoccurs time and again. And there are many species of the Borrelia, including mainly the Borrelia recurrentis and the homicide. And these Borrelia, they're carried by a different species or the genera of the tick. In this case, it's a soft tick, whereas the tick was hard in nature in case of Lyme disease. That was belongs to the genus Ixodes, and this is the genus Ornithodoros. And the humans, they are the accidental host. They are not the final host. Now, you must be, you see, surprised at listing 2-3 different genera of the ticks and bites that are responsible as a vector for the transmission of the disease. Actually, these diseases are the vector-borne disease, or the insect-borne disease, or the arthropod-borne disease. But you see, there is a specific medical microbiology branch which deals with these insects and ticks and mites and all those which are responsible for the transmission of the disease. Either they act as a mechanical vector or as a biological vector, or as a reservoir. Now, the name of that branch of medical microbiology is the medical entomology. The entomology is the study of the insects. Medical entomology is the study of the insects which are responsible for some of the diseases transmitted by the medically important organism. Now, the relapsing fever and the Lyme disease both are very common and of interest for the students, for those who are interested to pursue their MLEs, and if they are interested to go to the United States for working over there. Now, this organism is, you see, you will definitely find 1 or 2 questions in the MLE subject 1 program. So that's why I'm going through this microorganism. Otherwise, if you see from Pakistani curriculum, our curriculum as designed by the HSC along with that of the Pakistan Medical and Dental Council, you will hardly find any questions. But I can feel that maybe you can have some example or the transmission of this disease because of the species of the genus Sajid or the ornithodos. Now, this again is the spirochetal microorganism and have all the characteristics of the spirochetes. Like the spirochetes, they mature and they persist in the salivary glands of the insect of the intestine of the tick. And this means that the spirochetes, they complete a part of their life cycle in the body of the tick. Now, when an organism, it complete a part of its life cycle in the gut of the bite, or the tick. This is what we call as the biological vectors. The mechanical vectors are those which just carries the organism from one host to another host. And there is no involvement of any biological advancement of the organism within that body. But once you see the organism, it changes or it undergo development and it's processed through various stages of development in the host, in the tick. That's what we call it the biological vectors. So the genus Ornithodoros is the biological vectors for the transmission of the disease. The tick, it bites, and there is subsequent scratching, initiation, there is some painless area, and this is the way the disease is transmitted. Now, the epidemics of this disease because of the natural disasters, which have been coupled with that of the poor hygiene, crowding, inadequate medical attentions, has been reported. So unhygienic conditions, poor feeding, crowding, and inadequate medical facilities or attention to your body can lead to this relapsing fever caused by Borrelia recurrentis and is transmitted by a biological vector of a soft tick known as the genus form Ornithodoros. Now, if you look at the signs and the symptoms of the disease, it takes about, you see, about 2 to 3 weeks time to appear these signs and symptoms. It starts from the 2nd day, goes to the 15 days, and even when you see the blood levels of Borrelia is very high. The infectious dose of Borrelia is very high. We need at least 500,000 Borrelia cells per ml of the blood to cause the disease. The incubation period ends abruptly with the onset of the high fever. There is headache, there is joint pain, there is loss of appetite, and there is nausea and vomiting. Then shaking, chills, these are the common generalized signs and symptoms. That can be with any of the organism. But initially you can have these signs and symptoms. So compared to that of the infectious dose of just one cell in case of any organism, we can have more than 500 cells in order to cause signs and symptoms with the Borrelia recurrentis. This organism, it causes severe damage to the liver. And when there is a damage, the liver profile would change. You will have high level of liver enzymes. You can have jaundice even over there. The splenomegaly is there. The heart involvement can be. Then the kidney involvement leads to the kidney damage, resulting in uremia. And the cranial nerves, they are also involved, as we have seen in case of the Borrelia burgdorferi, and there was involvement of the 7th cranial nerve leading towards the palsy. So we can also have this with organism. The 50% of the patient, the hemorrhages profusely into the organs, so there are severe hemorrhages if you make histopathology. Now, this is how the nature of the relapses are there. Now, if you look, this is exposure to the organism during the 1st week, the 2nd week, and the 3rd week. And this is how it does look like. This is Japanese. You see, in this case, the first phase goes high, then it comes down. So this is the first phase of the high fever. Then it comes down. What happens when it comes down? There is sweating and weakness only. Then the second week it goes high again. Now specific antibodies are produced during this phase. First week, specific antibodies are produced. But these antibodies, they are different than that of the antibodies produced in the second week. Now again, there is rise and fall in temperature, signs of sweating and weakness. And then in the third week, the individual again feels high fever. Now this again, you see the headache and myalgia that we will see. So whenever there is a rise in the temperature, there is headache and myalgia. Whenever there is fall in temperature, you will see weakness and sweating. Now this goes for the 3 weeks. Now during the first week, the antibodies produced, they are different than that of the antibodies produced in the second week. Now the antibodies produced in the third week, they are different than the antibodies produced in the second week. This means that the organism is going in variations. Organism is changing its antigenic potential, its antigenic capacity, its antigenic variants. Now each week you have a different antigenic component of the bacteria that produce homologous antibodies, and these antibodies are specific against this antigen. So these antibodies, they do not provide protection against the second rise. And the second rise antibodies cannot provide protection against the third rise. So each and every week, because of the continuous variation in the antigenic composition of the organism, we have the different antigenic antibodies. So you can see the Borrelia bloods and the smears, and they're almost remain the same. But in the stage when there is high temperature, you can see the Borrelia. In low temperature, you cannot. Then again, you cannot see. So there are the fevers, because it follows the fluctuating pattern, and this fluctuation in fevers occur due to the change in the parasite and the immune response that is produced by the body. So this is what we call, because there is high fever, low fever, high fever, low fever. This is high fever is occurring time and again. This is what we call as the relapsing recurrence. Because of the spectrum of the disease, the organism that causes relapsing fever, it has been given the name of Borrelia recurrence of the thought. Now, the initial antibodies become useless because there is a change in the surface antigen during the growth. This means that we have, in the second phase, we have the antigenically altered cells. That's why the antibodies produced in the first phase are not effective in the second phase, and the antibodies produced in the second phase, sorry, they are not effective in the third phase. So the cell then they survive, they multiplied, and then they move on to the second stage of the disease. The immune system, it forms new antibodies and against the altered cells. In every stage of relapsing fever, in each relapse or high temperature fever, you have different immune system antibodies, and they are soon faced by another antigenic variation. So this antigenic variation, this is the survival strategy of the organism to cause disease in the body. When the body produces antibodies, the organism changes its shape, changes its antigenic potential, and starting producing disease again. Now, when the body, it acts against those antigenic components, it produces antibodies, then in the third phase, it changes again itself. So there is fight going on, and ultimately, you see the body is the winner, but maybe temporarily, because you cannot really eradicate the organism. Now, the single stain, it can have, you see, 24 different serological types based on to the antigenic composition. And eventually, there is a cumulative immunity developed in the body against the variety of the antigens developed. So you may have 1, 2, 3, 4, 5 episodes of the relapsing spikes in the body, and you have 3, 4, 5 multiple antibodies available. So these multiple antibodies, they cumulatively act against the organism, and there is complete recovery can occur. Now, the diagnosis, treatment, and prevention, the patient history, exposure to the area, clinical symptoms, and the presence of the Borrelia, burgdorferi, or recurrentus in the blood space can be seen. We can stain the organism with the help of digital stain, and we can see the organism under the ordinary microscope. The tetracycline is the drug of choice, except for the pregnant women, And children under 17 years old, because of its toxicity, we cannot give these pregnant women. It causes the tetragenicity, what we call as the damage to the fetus. The vaccines are not available, and the prevention depends upon the controlling of the rodents and the biological vectors like the tick bites. That was all about the Borrelia. We have covered 2 species, the Borrelia recurrentis, Borrelia burgdorferi, and within the spirochetes, we have gone through the Leptospira, the Borrelia, both genera, and we are still left with one of the very important, very, very important genera of the spirochetes that we will discuss next time. Thank you very much. Hope you enjoyed your time.